Welcome to the AANMC webinar today on applying to naturopathic school. We will be starting our webinar in just approximately 1 minute. Welcome, and we will see you in a minute. Good morning and welcome to Follow Your Heart, How to Apply to ND School with Allison Garris. Ms. Garris Mrs. Garris is Vice President of Admissions at the University of Bridgeport College of Naturopathic Medicine, and she's going to be joining us today to help you all on your journey. So really today is going to be about 30 minutes or so of a brief presentation on naturopathic admissions and what's required to get in. And then we're going to take your questions and cover a number of different topics around admissions and around getting into ND school, and as well as making yourself really a solid applicant to have a good shot at getting in. So with that, I am going to introduce Allison, but before we begin, I just want to go through some housekeeping. So this webinar is being recorded and it will be up on our website probably later on today, at latest tomorrow. It will also be up on our YouTube channel. So if you've missed any segments of this or you want to tune back in later, please feel free to jump on our website and look at this webinar and all our past webinars. And so with that, I am going to turn over the microphone to Allison Garris, who will be presenting today on applying to ND school. Allison, welcome.
Thanks, Joanne. Hi, everybody. Thank you for joining us today. I'm going to be talking about how to apply to ND school, and this will not focus on any one school in particular. We're going to talk about all of them. Just to give you some background on myself, I've been at the University of Bridgeport for 6 years. This is my 5th year recruiting for our Doctor of Naturopathic Medicine program, so I have a lot of experience in this area. And I also recruit for some other programs at UB, but this webinar is going to focus on the ND program across all of our AANMC schools.
Allison, would you be able to get a little bit closer to the microphone? Your voice is not coming in fully clearly.
Sure, how's that?
Much better, thank you.
So when we talk about ND schools, we are talking about those that are members of the AANMC. These schools are recognized by the U.S. Department of Education, the Council on Naturopathic Medical Education, and the North American Board of Naturopathic Examiners. Those are all important things to note, since going through an accredited program allows you to sit for licensure, and that would be through NCLEX 1 and 2. So any accredited program by the CNME is also a member of the AANMC, and those students are eligible for licensure, which is an important part to note, since you may be required to go through licensure if you plan to work in a licensed state. So the next slide shows where all of our accredited ND schools are. You can see that there are 7 total. There's Canadian College of Naturopathic Medicine, UB, National University, Southwest College, Bastyr, National University, Bastyr, and Boucher. So we are scattered across the US and in Canada. And we usually hear from students who are across the US considering all 7 schools. That's not unusual. Since this is a small field, we do recommend that students are considering more than one institution. If you can visit institutions, that's even better. They are far, so even sometimes just calling the admissions office to get information on programs is an important step and one that you should not overlook, even if you are in a certain part of the country and think you'll only go to one school. Calling the others just to get information is just how you do your research. So admissions phone numbers are always available on the website. No matter where you are, you should call a couple of institutions to talk to them about their programs. So we're going to talk a little bit about the curriculum. In the ND programs, you will have biomedical education and clinical education. Typically, your biomedical education is done in the first 2 years, your clinic education is done in the last 2, but institutions can really decide where all of these classes are held. But it is a very, very rigorous program. As you can see, the curriculum is very similar to that of MD schools. So this is good for comparison, and we'll talk a little bit further about this in some of the future slides we have here. But you'll see that many of the courses in the biomedical education are actually similar to some of the prerequisites that institutions require students to have. So you may be taking anatomy and physiology currently to apply for an program. You will take that course again at the graduate level, and it is important to have at the graduate level. So any work you're doing now is just good practice for you for taking that course at the graduate level. And as you can see in the clinical education, you get a little bit more specific, a little bit more complex. Those biomedical education courses are really the foundation to get you to the clinical education portion. And now Dr. Yanez is going to talk about the naturopathic therapeutics.
Thank you. Thank you so much. So, I think one of the highlights for me of naturopathic medical education, and really what differentiates the naturopathic education from other forms of schooling, are our focus on the naturopathic therapeutics as well as the naturopathic philosophies that are really woven through the entire program from day one. And so with the naturopathic principles and the therapeutic order, all of those are the types of things that make naturopathic medical education very unique and really delineate how we interact with the patient. So ND therapeutics include nutrition, mind-body medicine, lifestyle or wellness counseling, homeopathy, hydrotherapy, botanical medicine, just to name a few. There's also physical manipulation that is taught, and really when you're taking a look at the ND therapies, the entire patient is viewed in a holistic manner. So like if you're in an anatomy class, the one thing I love about MD school is if you're in an anatomy class, you're learning about the anatomical parts of the body, how they work, the physiology, etc. But you're also looking at the interconnectedness and how one organ system is related to another organ system and how they all connect and work together as a system. You are incorporating the lifestyle components, the mind-body components, the nutrition components, and everything. And so up now is a slide about the therapeutic order. And this is really, I always title this one, How Naturopathic Doctors Think. And so if you look at the bottom of this pyramid, this is really where naturopathic doctors will start their focus of their patient. So it's establishing the foundation for health. So that's things like stress, sleep, nutrition, exercise, social support. So really the basis for health. And we start there. NDs will move up through the pyramid to high force interventions, which would be things like drugs and surgery and suppressing symptoms. So it isn't that NDs do not learn pathology, do not learn pharmacotherapy or surgical interventions or when to refer for those things. It's just usually we're going to start at that foundational level first and move our way up as the patient needs. Now, obviously, there may be situations where a patient is in an urgent situation and we've got to go right away to suppressing pathology or higher force interventions. But usually, we're not going to start there unless absolutely needed. So that is a little bit about the ND approach to the patient case.
And now we're going to talk a little bit about the clinical rotation. So many times when students call an admissions office, they are most excited about getting into clinic, which can sometimes take 2 years once the student has completed their biomedical education. So we know how excited you are to get to this point, but the first 2 years are still very, very important. But when you do reach this point, it is very exciting to be able to take the knowledge you've learned for 2 years and a lot of that foundational information and apply it to actual patients in front of you who need care. So we know that this is a big part for students. This is really what you hope to do in the future, is actually working with people. So some programs do allow you to start your clinical experiences in the first year. Other schools may have you wait until third year. That will depend on the program. So if you have questions about that for a specific institution, it's best to contact admissions. You will complete a minimum of 1,200 clock hours. There are team care shifts. So some programs may also offer acupuncture, master's degrees, nutrition. There's lots of other things there. And so sometimes when you're working on your clinical rotations, you might actually be working with other students in other disciplines. It's a great way to get experience in integrative care. Many institutions offer community outreach clinic shifts. Those are an excellent way to go out into the community and really see how that's different from some of the patients that you may see in an on-campus clinic. Also, just getting off campus can make that experience seem a bit more real to you since you're not in your institution any longer. And we highly recommend a diversity of clinical experiences that makes you a well-rounded ND. And of course, many programs also offer a specialty focus shift. So if you're really interested in working with pediatrics, that's a possibility. Many students, when they inquire about an ND program, are not really sure who they want to work with specifically, and that is okay. Even if you think right now that you know you're going to only work with kids, it's still good to experience other things and keep an open mind throughout your education. So now we're going to go a little bit deeper into the MD-ND comparison. So the slide that you're seeing right now is comparing the number of credits for each of the areas listed under topic. This was taken last year just as a comparison for you here. But as you can see, in many areas, naturopathic medical education meets or exceeds the number of credits that MD students complete. So anatomy and embryology, physiology, biochemistry, pathology are all areas where our students are doing just as much or more. And so sometimes students are curious about, what are some of the similarities between an MD and ND program. They're actually very, very similar. In a lot of ways, our ND students are really going into more detailed information about these specific topics, which again is why you need a strong background in the sciences before taking those at the graduate level. And Dr. Yanez is going to talk a little bit about this one specifically.
Sure. And so earlier I mentioned in the curriculum the components that really highlight naturopathic education. And so you'll see when you're looking and all curriculums have some variation in the allopathic world as well as in the naturopathic world. So this is an estimation. However, you'll really notice where ND education excels are in things like nutrition and counseling and health psychology, structural or physical medicine, botanical medicine, and homeopathy. And those are the areas that really are distinct to naturopathic medicine. In many schools, there will be Asian medicine also incorporated within the ND curriculum, just as a foundational understanding of how acupuncture and Asian medicine works. And so those are all things that are very unique to naturopathic medical education in North America and core to our focus. Now, you'll also notice that there is pharmacology. It is included really from a perspective of patients coming in with conventional pharmacology. And so as part of our pharmacology courses, you learn drug-herb and drug-nutrient interactions, how to safely prescribe botanical medicines and other nutrients to patients who are taking pharmacological medicines. And so that's really the understanding of the prescriptive authority for naturopathic doctors, as well as many of the natural substances that are prescription only, at least in North America. So that is kind of a little bit of the comparison and understanding the education and scope for NDs.
So now we're going to talk about how you spot an ND. And this sometimes is very obvious. Sometimes students have been searching for a career where they can have a holistic approach, but also do physical medicine. And they often stumble upon the idea of becoming a naturopathic doctor, and that is sometimes through personal experience. So if you are a student who has experienced naturopathic medicine in some way, and you are even the slightest bit curious, it never hurts to just contact an admissions office or talk more with that ND about what exactly they do. Because many times NDs are interested in mind-body medicine, but also exercise, stress management. They usually want to rely more on herbs than medication, although there's a healthy blend of all of that. So our NDs understand the art and science of medicine. They are socially concerned individuals, so they see trends going on in the population in terms of sicknesses and want to be able to affect that. They are respectful of the environment. They are usually very, very friendly people and tend to dislike the very brief interactions that you can have with a doctor. They want to have a personal connection. They absolutely like to get to the root of the problem. You'll hear that a lot in your education. So why exactly is patient A getting headaches all the time rather than giving them something to take the headaches away? Can we figure out why they're even starting in the first place? And they measure their personal success in terms of impact. So how many people they are able to help, not necessarily how many letters they have beside their name or the size of their practice, but can they really make a difference in someone's life? And of course, as we already talked about, the curriculum is very rigorous. So graduates are going through a rigorous program in order to become an ND. And they also have a spirit of volunteerism, which we sometimes see even in the application process. So if you are interested in this type of medicine, we absolutely encourage you to explore that now through volunteering. Even within your community is an excellent way to get some more exposure. So we'll talk now about the ND student profile. So again, students with a holistic view. Oftentimes students, when they're kind of finding out about naturopathic medicine, they will say that they use Google and are using terms like holistic doctor, natural doctor. If you have done that before, then this is what you're looking for, and you should absolutely, start on that journey by calling an admissions office to figure out what exactly you need to do to get there. We have lots of undergrads who are beginning to find out about the field. They're ready to enroll in a graduate program, but haven't really found the right one that really balanced all of those needs that we talked about in the last slide. Again, former patients who have had a positive experience with natural medicine are often inspired to become an ND themselves. And then travelers who have seen healing practices in other countries, and they become interested in something that is a little bit different than what they are used to here in the United States. So if any one of these resonates with you, again, you should do what you can to explore it. So prerequisites is often a very important topic for students. This webinar is going to speak generally about all of the ND programs. So if you know there is a program that you are really interested in applying to, you absolutely should call the admissions office to find out what those prerequisites are. Many ND students do have an undergrad degree in the biological sciences, but absolutely students come from many different areas like the liberal arts, healthcare, or physical sciences. we really see students across the board. Some have bachelor's degrees in fine arts, others are microbiology majors. So where your background can only enhance your education. So there's no requirement that you absolutely have a bachelor's of science in biology. We absolutely work with students from across lots of different fields. The prerequisites, typically institutions will require work in biology, general chemistry, and organic chemistry. Sometimes institutions may require biochemistry, physics, math, and psychology. There is a lot of overlap between the ND programs in terms of prerequisites, but when it comes to meeting eligibility requirements, you have to check with those specific schools. Some schools, for example, will absolutely require A&P 1 and 2, and another school may say to take 6 credits of biology. You can find a lot of overlap there, so that institution may say, we will use your A&P 1 and 2 as your biology credits, and you're really killing 2 birds with 1 stone. But calling the individual schools, going to the websites, figuring out what exactly the prerequisites are crucial to your success throughout the admissions process. Usually there is a cumulative GPA requirement. There may also be a GPA requirement for specific prerequisite courses. This can help determine who is called in for an interview. Interviews are sometimes on campus or virtual on the phone via Skype. That will depend on the institution. The GPA requirements, like the prerequisites, depend on the institution. So these are the questions when you call an admissions office that you need to be asking them to figure out where it is exactly you need to be and what your next steps are. So we talked a little bit about this already, but as I mentioned, about 40% of the students enrolling in an ND program, their undergraduate major was in biological sciences, but they're followed very closely by liberal arts. So don't be scared off by the fact that many students are in the bio world. If you are not, you are still eligible, and you may have prerequisites to take. You may have more prerequisites to take than a student who completed a biology degree, but many students are taking the time to go back. And even some of our bio students have missed 1 or 2 prerequisites that were not included in their bachelor's degree. So it's very uncommon to see a student who meets all prerequisites across the board. Usually students have to take 1 or 2 things, so don't let that intimidate you by any means. In terms of age, so this is a very diverse field. So most of the students, as you can see, are between 25 and 29, but the more non-traditional group of student in the 30 to 39 range is also the second largest group. We absolutely enroll students who are beyond 39. There's no age limit, so students can apply regardless of age. But for many students, they are finding out about naturopathic medicine a little bit later in life. And again, some of those students are in their mid-30s. That does not mean it is too late at all. Each year, programs will enroll a wide range of students in terms of ages. But again, it's all based on qualifications, which are determined by those prerequisites and your GPA. So if you are a little bit older, just found out about naturopathic medicine, don't be deterred by the graph you see. We certainly work with students who are a couple years out from undergrad, have some work experience, whether that is related or non-related. All of that makes you a well-rounded student. So absolutely, if you're interested in this, please make sure you're contacting an admissions office to really talk about your specific situation. Now, when it comes to applying, there are really 2 ways that a student can apply. One is by using NDCAS, which is the Naturopathic Doctor Specialized Application Service. We have 4 schools that are currently using NDCAS. That's Boucher, UB, CCNM, and SCNM. The other institutions have their own applications, which you can find on their website. Usually you have to submit a personal statement and resume, transcripts, letters of recommendation, and again, an in-person interview may be required. For more detailed information on transcript, how many letters of recommendation, what type, you'll contact these schools directly for that information. But this is the way to start on the application to an ND school. If you have questions about when the best time to apply is, those should be handled by the admissions office at each individual school. And we'll talk a little bit more about the NDCAS system. So this is really a service to students. It's meant to streamline the application process. So if you are a student who will be applying to, for example, UB and SCNM, rather than submit 2 applications, you can submit 1 through NDCAS. You would submit all documents to NDCAS. Once everything was received and verified, that would go to both institutions at the same time. So it saves you a lot of time in terms of applying because you're only doing that step 1 time. You don't need to complete the application in 1 sitting. And what that means is you don't have to log on to NDCAS, create an account, upload everything, hit submit, and have a completed application. You can do things 1 at a time, even if that is just starting the application and submitting a personal statement in 3 or 4 days after that. Financially, it is always a big concern for students. So we like to talk with them in depth when they are going through the application process. So this is a first professional program, which means that students are eligible to borrow up to $40,500 in unsubsidized loans per year. Typically, that covers more than tuition and fees. Sometimes students will accept that full amount, and if they are getting a refund, use that to cover living expenses. Now, when we say refund, we're not talking about free money. We're talking about leftover loan money that you don't need to pay for tuition and fees. If you receive this refund, it's still loan money. It still needs to be repaid, but it is available to you to supplement the living expenses. Most students are relocating when they're completing an ND program, and so you can use those funds to help supplement the lack of income, since most students do not work while completing this program. To apply for financial aid, you'll use the FAFSA. You'll include the school code and just make sure you are filling out the graduate FAFSA, since this is a graduate program. School visits are important to make. Again, it may be difficult to travel across the country to visit all the schools, in which case, even calling is an excellent step in the right direction. Open houses give you a good experience, or give you a great opportunity to speak with deans, faculty, and current students, and also admissions. Usually you are able to see the campus. You may even be able to sit in on a class. There's lots of different opportunities there, but if this is something you're thinking about seriously, you should really consider visiting and getting as much information as possible. This kind of plays into the idea of researching the school. Just because you are 10 minutes from school B does not mean you need to go to school B. You should still be looking at schools A through D or whatever that may be. So absolutely pay attention to this step. Many institutions offer student for a day or info session or prospective student day. They will all call it something different, but you're able to come to campus, observe some of the classes, have a campus tour, and sometimes you may even be able to be part of clinical rotations. Again, the point of these experiences is to give you a better idea of what it is like to be a student at that institution. This is a 4-year program. Classes are typically held 8 to 5, so you want to make this, you really want to take this very seriously. It's not a decision you want to take lightly, so visiting is very important. And when you visit, you would most likely meet with admissions. Sometimes they're admissions advisors or counselors. They can look at your transcripts and let you know which prerequisites are outstanding, how your GPA is looking in terms of their requirements. You can ask questions that are important to you, especially as you think about some of the things that you'd like the program to have. So this is a good opportunity for you to really get some of those answers. Again, you do not have to do this in person only. You can do this via phone. And meeting current students is also an excellent way to learn more about the program. And we have some upcoming AANMC events. On May 15th at 12 p.m. is It My Hormones? Combating PMS and Irregular Periods Naturally. And that's a free webinar. And then after that, on June 20th at 3, we have Sports Medicine as a Naturopathic Niche. And you can register and find out more by going to aanmc.org/events. And thank you so much for attending the webinar. I hope that we answered a lot of your questions. This slide shows you all of the schools that are part of the AANMC. So if you're curious about any one of the schools, you can go directly to their websites to find out a little bit more about their program and admission requirements.
Thank you so very much, Allison, for that webinar. I really appreciate the information. A couple questions have been coming in, and there's one really common question that we get that has a couple different variations that maybe you can go into. And so right now we have a graduate from a naturopathic school in the UK, and she is asking about whether the credits from the UK will transfer to North American schools.
So that question usually has to be answered by each individual school. There's not a real blanket answer there. Some institutions will look at the level. So we have worked with some applicants who completed or had degrees in progress internationally, but the degree was at a bachelor's degree level. We would look at credits and grades before making any determinations. So sometimes the coursework from an international ND program can satisfy prerequisites. Sometimes it can be used as transfer credit. So that is a question best posed to each institution that you plan to apply to. But you want to be aware that more than likely you will be asked to submit a course-by-course evaluation so that we can see on the US scale the number of credits, grade, and degree earned.
Thank you so much. Would you be able to get a little bit closer to the mic? I'm still getting some feedback.
Sure.
Thanks. And I think a subsequent kind of follow-up question to that would be for a licensed medical doctor or a licensed nurse practitioner or a licensed chiropractor or someone from a licensed profession, and what their process would be for possibly applying for advanced standing.
So that again is determined by the institution. Typically, students who hold a medical degree are eligible for advanced standing in an ND program. Each school determines how much of the program you have to complete. Some programs require you to stay there for 2 years, some may be less, some may be more. That's going to be institution specific. For other programs such as nursing, you may be able to use some of your coursework to satisfy prerequisites. You may be able to have some of those courses counted as transfer credits, but these are questions best suited for those individual schools since they all have their own policies on transfer and advanced standing credit.
Another question that comes in pretty regularly are students that earn their degree in Canada, and can they practice in the US?
That question is, we usually have the academic department talk with the students about that.
So I can answer that. So the students who earn their degree in Canada can absolutely practice in the United States if they have gone to a CNME approved school. So CCNM and Boucher graduates both take or are eligible to take the NCLEX examination, which is the requirement for licensure. in the United States. And so if they pass NCLEX and they have the ability to work legally in the United States and can pass background checks and things of that sort, they are eligible for licensure in the United States, the states that are regulated. So, and another question that comes in, are there disadvantages to earning a degree in Canada? And across the board, there are not. The degree is on par with the degree for all of the North American schools. Sorry, Allison. I get that question so often. So one other school here, or one other question rather, is about the scope and states that NDs can do spinal manipulation. And I don't know if you have an answer to that, or you'd like me to take that.
Oh, we don't really go into detail with that with our students in the admissions office, so I'll let you answer that one.
Sure thing. So naturopathic schools do provide training in manipulation, and typically that is going to be covered underneath the scope of naturopathic physicians in the states that are licensed. But if you have any questions about scope of practice, and I know there were a couple that I answered typing while Allison was speaking, so if you have specific questions regarding scope of practice in either a state or a province, the best place to go is that state board and look up the jurisdictional scope and regulation, the legal language that delineates that. Another really good place to get information if you've got a state or provincial specific question is to go to the state or provincial association. So every one of the regulated states, as well as pre-licensed states and provinces, all have state associations. And those are really great resources, especially for prospective students to start networking. And one thing that I think we didn't really touch on as much, and maybe Allison, you can go into this, is, how do you make yourself a strong applicant? What are the types of things that an admissions counselor looks for in an applicant, in your letters of recommendation, in your lifetime experiences? And, I think that would be maybe a good next thing to cover if you don't mind.
Sure. So this may again vary by institution, but I think across the board, all of us are really looking for students who have done their homework on what an ND is. So you may want to check with the individual schools, but even if shadowing experience for a certain number of hours is not required, it is almost always highly recommended. Shadowing an ND either physically or interviewing them over the phone or via email is so important to you as a student. Enrolling in this program is a large commitment of time and finances. So you should have a very strong idea about what it is to become an ND and where you might like to go once you graduate after the 4 years, and doing your homework and really speaking with NDs, and even for healthcare providers who might work with NDs, is going to be beneficial to you. GPAs are also very important because you can take between 7 and 10 classes in a given semester or term or trimester. We need to know that you are academically prepared to handle the rigor of the program. So if you have taken all of the science prerequisites, but your GPA is a little bit low and you have some time, you may want to take a course over or take a new course to demonstrate that academic ability, since that is a large part of the application process. In terms of just general work experience, really, we don't put parameters on that. So for students who are coming straight out of undergrad, they may be able to demonstrate things like initiative through clubs and organizations that they've been with. Some of our older students who have been out of their degrees for longer may have work experience that has really strengthened their time management skills, and that's also very, very important. If you're able to get some volunteer experience with an ND, that will go such a long way for you. But even as long as you're able to take away certain skills from the current things that you're doing that show responsibility, passion, initiative, that you're goal-oriented. Those are all things we are really looking for in the application process. Some institutions will require that you submit one letter of recommendation from a healthcare provider, and that is to know that someone has seen you professionally, either just shadowing, but they know that in 4 years, if you were to graduate, they would be comfortable with you working alongside them. We want to know that someone who is currently working in the field can see you as a future colleague. So having a letter from a healthcare provider, if it's not recommended, is an excellent way to demonstrate that you have really gone the extra mile and that someone already working in the field knows that you would be, a very effective ND in the future.
Thank you so much. So I'm not seeing any additional questions. Maybe I think it would be cool actually if you went through maybe some of the like 1 or 2 top questions that you get from applicants and how you would respond.
So the question I always get is, what makes your program so different? So the best way for you to really go about that is, one, you should have a list of things that are important to you as a student. An admissions office is going to tell you what makes their program special and the best. But if it doesn't match up with what you are looking for, then it doesn't really make any sense. So a better way to go about that is to have a list of the top 3 things you need in a program. Call an admissions office and ask if they have those things. That's a better way to go about that question. And it also helps you to determine what you are really looking for. When students call an admissions office and say, tell me why I should go to your program, it can lead to information overload because you are now hearing from several different people why you should come to their institution, and they're all really great reasons. But if you don't take the time to figure out what's important to you, you're going to be very confused, have a very hard time deciding where you want to go. So I recommend going through the websites first, looking at curriculum, talking to people if possible, like current students, making a list of your own that is important to you, that you know you cannot give up, you cannot compromise on, and call the admissions office and ask specifically about those things. They will more than likely give you more information and may even talk about things that you were not anticipating or things that you come to realize you care a lot about, and that's okay. But you have to have a clear idea of what you are looking for. That will make the process much easier on you. So that's definitely probably the question we get most frequently. Secondly, we hear from a lot of students who did not come from the science background, who need to go back and take prerequisite coursework. And we try to give them an idea of, about how long that may take them, depending on the student's current work experience, if they're a full-time or part-time employee somewhere, if they have a family. That will all depend on or determine how long it takes you to complete prerequisites. We tell students between 1 and 2 years. Again, a student who can take 4 classes in 1 semester will be done probably within the year. So that will take some planning on your end to figure out, when is the best time for you to do this and the actual time frame. But certainly don't feel discouraged if the answer is it may take you 1 or 2 years to complete prerequisites. Again, that really depends on you, but many students have to complete prerequisites. Many students work while taking prerequisites to pay for their prerequisites. So although that sounds like a long time, almost 70% of the students who are inquiring about the degree and end up enrolling have dedicated the same amount of time as you will to just being prepared for the program to apply.
Thank you so much. So there is a question, and this is one I get often, about the ND job market and how schools assist students with that. Would you like me to take that, or do you want to take a stab?
I can talk a little bit about that, and then you could fill anything in.
Sure.
So not all institutions will have job placement offices. Networking is something you can do throughout your four-year career, especially as you go into clinic and you get into clinic sites. Many students, when they enter the program, have an idea of where they're going to go and which state, and that often changes at the end of the four-year degree. So students do need to remain open about their options, but networking is so important when you're on those clinical shifts. Many times students will even make connections within their own group and will, sometimes work together after they graduate. But for our students, we find that networking is just so crucial to them, and that does take initiative, and that, again, is one of the things that we are really looking for in the application process.
Thank you. I ditto that. I actually tell students when you're planning, there is a three-part plan. So there is your academic plan, and that would be your prerequisites and making sure that you're ready to start the academic portion of the program. There's your financial plan and what your personal finances are going to be and how you're going to finance the education as well as your time during the program. And then there's the personal plan, and that is your family support and any personal issues that you need to work out to make this program successful for you. But when I think about the job market, I counsel every student that I speak with to start coming up with your idea of, well, first off, thinking of this as an investment in yourself. This is an investment in your career, in your brain, in your health, in your happiness, and what are you going to do with that investment? So what does this degree mean to you, and what are you going to do with it? And I really challenge students from day one to start thinking about that very seriously. Every month we do webinars and we highlight in our newsletters as well naturopathic doctors who are successful. And I ask every single one of them, what are your tips? What do you tell students? And emphatically, I hear from folks, start planning early. The folks that we hear from that maybe have trouble when they get out, honestly, oftentimes have some characteristics. Either they're not really sure how they want to practice or how they want to use their degree. They're not solid in their value and their worth, and they undervalue themselves, which can be an issue with healers and givers and people in the healing arts, and wanting to give what you have away for free, and that can very much be an issue for folks. And third, really coming up with a solid strategic business plan of how you're going to use this. Like Allison said, networking early. It's never too early to start going to conferences and talking to doctors. Myself and many of my colleagues who really networked and pushed hard during school honestly had job offers before we even graduated. And so that should be your goal if you are going into this, is to get really clear on what you want to do, how you want to use this degree, and graduate with a job offer or two or three or four, and then you're choosing what you want to do. So the job market, and there's career data out there. There's I don't have the website in front of me right at the moment, but there is data showing that the natural products and natural health industry is on the upshot. All you have to do is take a look at Walmarts and Targets selling organic food and people having interest in healthier lifestyles to see that this is an area of a lot of interest and growth. The job market and the careers for NDs are also growing. While the vast majority of folks do want to do clinical practice, we're seeing a lot of graduates teaching, going into the natural products industry, writing. Right now, there are a bunch of docs on Facebook all bragging about their books being in Barnes and Noble. Uh, there's really a growth in the popularity for what we're doing and the interest for what we have to offer the job market, and so the outlook really is a positive one. But like was mentioned before, it takes a little bit of elbow grease, and it definitely takes some determination. uh, so there is let's see, so there have been a few questions here about the program and trimesters, semesters, and so I encourage those of you who are asking about if the programs meet for the entire year or the curriculum schedules, to reach out to the individual schools, because that's going to vary. Some schools go year round. Some schools will take a brief summer break. Um, and some schools may offer clinical experiences over the summer. So that's going to vary from school to school, as well as the application deadlines and start dates. So I hope that answers your questions, James. Um, and then there's another question here, and we'll take probably one or two more questions before we close up. What is the difference between a naturopathic doctor and a naturopath or a naturopathic practitioner? Um, before you answer, Allison, AANMC actually did a piece on this. We have on our website, and I can find the link in a moment for you. That was actually written by somebody who went to one of the online correspondence schools and then went to one and is currently a student at CCNM. And there is a really stark difference between the training that naturopathic doctors do versus online programs. And let me just say, and somebody asked earlier, are online programs an option? And they are not. If you want to be a regulated and licensed naturopathic doctor, online programs are not standardized or accredited by an agency that is recognized by the United States Department of Education. And so with that also comes the risk of having a program that is not accredited, and if it closes, you do not have the safeguards of the government process and standards for that. I don't know if you wanted to say anything else about naturopathic practitioners versus naturopathic doctors, Allison.
No, that does say a lot. We absolutely want students to know that if you are interested in making this a career, you really should be thinking about an accredited program, especially because of the licensure there. The online programs are not offering the same rigor. So we don't ever want to see a student enroll in an online program and even expect classes to transfer. That again will depend on each institution, but it's sometimes just an impossibility. So please, 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 if you're thinking about this as a career, we really want you to consider the accredited school, since those lead to licensure.
Thank you. And there's another question here about, can NDs work with MDs?
Yes. We get that question sometimes in the admissions office. Absolutely. There are integrative wellness, places or offices, and lots of students when they graduate are actually joining existing practices, and that can be with, sometimes a chiropractor and sometimes an MD who is very interested in naturopathic medicine but doesn't have that formal training. You can really help supplement that. So absolutely, students can work with MDs. Some of the ND programs even have MDs on the faculty. So absolutely, that is a possibility.
Yeah, agreed. I think when one of the questions that we'll get from time to time is, are NDs against medicine? Are they against pharmacology? Are they against working with medical doctors, and vice versa? And the answer is emphatically no. Like we said, we have medical doctors on faculty. We have even medical doctors who come and complete the naturopathic program. There are many in the conventional community that see the benefit and refer to naturopathic physicians for our specific areas that we offer patient care. There's recently a joint venture here in California at a hospital where there's an MD and an ND working side by side, creating a hospital integrative wellness center. NDs are on staff at places like Cancer Treatment Centers of America, working on alongside conventional oncologists. And so, I think that is a myth. We actually did an article, we wrote an article on the top 10 myths in naturopathic medicine, and that was one of them. And so there's no anti-MD sentiment, very much so. We learn how to, and naturopathic doctors learn what is appropriate patient care and standard of care and safe care, and in some cases that is referring to specialists for, things like radiation or, different oncology specialties, endocrinology, immunology, laboratory diagnostics, and things of that sort. So yes, the longer response to that is NDs work very collaboratively as part of the integrative medical team. So I'm not seeing any additional questions, and I know that we're just about out of time. Thank you, Allison, so very much for your time today with answering these questions. And for those of you who've tuned in, we will be recording this, or we have recorded it, and it will be up on our website shortly. Allison, do you have any last parting questions or thoughts for our folks before we hang up?
The only thing I would say is if you have a question, please don't be shy about contacting admissions. That is what they are there for. So anytime you have questions, just reach out and get those questions answered.
Wonderful. Thank you so much. And to all of you who joined us today, thank you for coming. And I hope to see you on another AANMC webinar. Thank you all and have a wonderful day. Thank you, Allison, again so much for coming on board today. I will be talking with you sooner rather than later, probably.
Okay, we're good?
Yep, we're good. Thanks so much. Take care.
You're welcome. See ya.